Thanks. Hi. So happy to be here. I really appreciate the Dairy Innovation Hub. My position's funded by the Dairy Innovation Hub. My lab, which hopefully you'll see later, supported by the Dairy Innovation Hub. I have a lot of projects funded by the Dairy Innovation Hub, so a lot going on there. I've been here for 4.5 years now. Whew, I'm getting up there. We're just looking, I have like 3 gray hairs. Maybe in 3 years we can report back at the next summit here. We'll see where they're at. I don't know. But today I'm talking about a project that literally started via LinkedIn conversation between my collaborator, Dr. Joe Pierre at UW-Madison, and myself. And I'm really excited about it, if you can't tell. Hopefully it doesn't translate into just talking super fast, but we'll see. So talking about milk lipids in IV systems. So some individuals who can't digest nutrients normally have to have an intravenous source of these nutrients. This includes milk fat. Includes fat, includes lipids, as well as proteins and carbohydrates. The lipid component is administered via oil and water emulsions. That means tiny droplets of oil in water administered through the veins. But to be suitable for intravenous application, the droplets have to be very, very, very small, less than 300 nanometers in size. That's very small. 350,000 patients per year within the United States require this type of nutrition. So it's not a small grouping. Neonatal patients require this type of nutrition. Historically, the lipid source has been soybean oil-based. And you can see some products that are used for this. Again, lipid formulations and their lipid sources here. The most common, the 100% soybean oil-based, all the way down to fish oil. Fish oil is actually not used for routine care in the United States, but you can see some oil blends there. The issue with the soybean oil is that it's abundant in what we call phytosterols. If you consume these normally through oral consumption, they are metabolized properly. If they're through the veins, they actually accumulate in the liver and cause liver issues. So, soybean oil-based formulations have been associated with all sorts of adverse side effects. This is just one study in 107 neonatal intensive care unit patients, and you're looking at the top row there, 2 different formulations, intralipid, again, that really abundant or concentrated soybean oil formulation, and then SMOF lipid, which is a soybean oil blend. But you're looking at the intestinal failure-associated liver disease in these patients at 45% for that first formulation. It's a big issue, a lot of adverse side effects associated with this. So via LinkedIn conversation, Joe sent me a message. We started talking, is it possible to use dairy-derived lipids for this application? So if you're familiar, milk fat has a very broad, what we call fatty acid profile. Short chain, long chain, unsaturated, monounsaturated, saturated. It's very diverse, over 400 unique fatty acids in milk. Can we use these for intravenous application? So looking at some of the results, first, we have to establish that small particle size that's required. And in my lab, I have a high-pressure homogenizer, which again, maybe you'll see later, my little baby. We've named her, you'll see in the lab. But you process a liquid sample, as shown here. In our case, it was milk fat, an emulsifier that we identified, and water. We send it through a very, very, very small opening, as shown here, to disrupt those fat globules. We then can cool the sample immediately, apply some back pressure to reduce cavitation, and collect our sample out. This system operates at up to 300 megapascals, which is 3 times the deepest part of the ocean, or roughly 40,000 psi. Okay, so very, very high pressures. It's a unique system. So first, can we establish that small particle size? In conventionally homogenized milk, you're looking at a range of 200 to 2,000 nanometers, so too big for this application. The particle size, again, for intravenous emulsions, has to be less than 500 nanometers, ideally around that 300 nanometer mark. When processed with 300 megapascals in our system, we are able to establish that particle size. So here on the x-axis, you're looking at the size. On the y-axis, you're looking at the concentration of particles within that size range, and 300 nanometers is right there. So we are establishing particles that are small enough. They're also stable to autoclaving, so we can sterilize them. And they're also stable for over 3 months based on our studies. So we've established a small particle size that's stable and that we can sterilize. So now, I make the emulsions here, ship them over to Madison, where Joe is working with this really cool system that can monitor the real-time metabolism, respiratory exchange ratio, movement, and water consumption of mice with tubes going into their intravenous system. And you can zoom in here. There's a little mouse living his life with maybe our milk fat emulsion going into him. Okay? So really, really cool system, again, showing the that the collaboration here is very necessary. I make the emulsion, I ship it over there, he has his system over there. So first, looking at the survival of these mice. So x-axis there on the days, y-axis is the probability of survival. Importantly, the mice are surviving with the milk fat emulsion. Similar to the soybean oil-based one, they're surviving. So I want to pause there because it seems like, okay, we've reached the minimum standard, right? They're living. But that's awesome. I like to say to my students, we're basically injecting these mice with butter, more complicated than that, but they're surviving. Like, that's new technology. That's pretty sweet. If we look at the body weight of these mice compared to mice that are fed normally, mice that are injected with the soybean oil-based formulation and then the milk formulation, and looking at their body weight, no statistically significant difference. So these mice are able to utilize that lipid. And actually, if you look at the respiratory exchange ratio, so on the x-axis here, you have time. On the y-axis, you have the respiratory exchange ratio, which is basically showing how are these mice able to utilize the nutrients that are provided to them. The lower the respiratory exchange ratio suggests that they're able to utilize the nutrients better. And the milk fat formulation trended lower. Okay, so they seem to be better able to utilize the milk fat than they're able to utilize the soybean oil-based formulation. This data together, the lower respiratory exchange ratio, as well as survival and body fat or body weight, suggests that they can utilize this milk lipid potentially better than the soybean oil-based. But again, we have to increase the power, we have to increase the sample size here, but really sweet preliminary data. We also looked at the pancreatic cells of these mice. On the left, you have the mice given the soy lipid. On the right, you have the mice given the milk lipid, looking at their pancreatic cells again, and it appears that there's lower inflammation in the mice provided the milk lipid. Okay, and you can see that with the size and the spacing between the cells there. So altogether, current intravenous fat emulsion formulations are insufficient and cause numerous complications. Milk fat has promise as a suitable lipid source. We need to increase the size here of our study. We have that diverse fatty acid profile I mentioned briefly. So again, over 400 unique fatty acids. We can achieve adequate particle size and stability with our high-pressure homogenizer. We seem to have apparent reduced respiratory exchange ratio, which suggests better utilization of this lipid, as well as the apparent reduced pancreatic cell inflammation. I've added that asterisk there because, again, need to keep increasing the sample size here and evaluate it further. But with that, I love showing all the pictures. It's so cool. So the Dairy Innovation Hub, WISES, have supported this work. Dr. Pierre, again, all started with a LinkedIn conversation, and he initiated that LinkedIn conversation, so that was cool. His postdoc, and then 4 of my undergraduate students who have helped to make these fat emulsions. So very cool work happening at River Falls and Madison and all together across the Dairy Innovation Hub.